This is the teaching presentation for Module 1B, Pharmacodynamics and Pharmacokinetics. This is the teaching presentation for Module 1B, Pharmacodynamics and Pharmacokinetics. Pharmacodynamics. This is studies of the drug action on the body's biological response to drugs. Here we're talking receptors, ion channels, and enzymes. When we talk about pharmacokinetics, we're talking about the movement of drugs through the body, kinetics. Here we're talking about absorption, distribution, metabolism, and excretion with the mnemonic ADME. ADME, absorption, distribution, metabolism, excretion. Now we're talking inducers versus inhibitors. Inducers increase the metabolism of a drug, decreasing the serum level of the drug. Think of induce as eating up of a drug. Inhibitors decrease the metabolism of a drug, increasing the serum level of the drug. When someone talks about half-life, what are they talking about? It's the time needed to clear 50% of the drug. 5 of these half-lives are needed to achieve a steady state. Working on the CYP inducers now. Might act on bullshit crap gaps. And remember, smoking, it is the polycyclic aromatic hydrocarbons doing the damage. Okay, the mnemonic might act on bullshit crap gaps. Methadone, alcohol, carbamazepine, tobacco, oral contraceptives, barbiturates, sulfonylurea, cyclosporin, rifampin, antiretrovirals, phenobarbital, griseofulvin, an antifungal, phenytoin, St. John's wort. Okay, so the very most common CYP inducers, remember SARS, S-A-R-S, St. John's wort, anti-epileptics, rifampin, smoking. Repeat, inducers versus inhibitors. Inducers increase the metabolism of a drug, decreasing the serum level of the drug. Inhibitors decrease the metabolism of a drug, increasing the serum level of the drug. Repeat, inducers versus inhibitors. Inducers increase the metabolism of a drug, decreasing the serum level of the drug. Inhibitors decrease the metabolism of a drug, increasing the serum level of the drug. Okay, now we're going to work on memorizing the CYP inhibitors. The mnemonic is sickfaces.com. Sickfaces.com. Sodium valproate, isoniazid, cimetidine, ketoconazole, fluconazole, alcohol, chloramphenicol, erythromycin, sulfonamides. ciprofloxacin, omeprazole, metronidazole. High yield information. 2C19, reduced activity in 20% of Asians and 19% of African Americans. 1A2, inhibited by SSRI and induced by cigarette smoking, which affects olanzapine elimination. 2D6, Caucasians are often poor metabolizers. 2D6, fluoxetine, paroxetine, and bupropion are strong inhibitors. 3A4, inhibited by SSRIs, induced by carbamazepine, impacting oral contraceptive levels. Inducer, cause low serum levels. Inhibitor, cause high serum levels. Smoking and dosing of meds. Smoking is a strong inducer, therefore smoking increases drug metabolism, and you need to dose higher. If they stop smoking, serum levels will increase. Continually assess for smoking. Liver disease can inhibit enzymes and increase the risk of toxicity. First pass effect. Factors affecting metabolism. The shotgun facts. Age. Young children have rapid metabolism, lower drug concentrations, while older people have slower metabolism, higher risk for toxicity. Elderly specific factors. Decreased intracellular water and protein binding, low muscle mass, reduced metabolism, and increased body fat equals increased risk of toxicity. The liver inhibits enzymes, so with disease, there's an increased risk of drug toxicity because the first pass effect is missing. Renal insufficiency or acute kidney injuries can result in elevated serum concentrations due to reduced GFR. Kidney diseases or medications that impact renal clearance, such as NSAIDs, ibuprofen, thiazides, and ACE inhibitors. Think heart failure, blood pressure issues when you see lisinopril or any ACE inhibitor. They may heighten serum concentrations of drugs excreted by the kidneys like lithium. Nutritional status, low muscle mass, reduced protein, and increased fat stores can lead to increased drug concentrations and risk of toxicity, common in older people. Intracellular volume affects drug concentrations reduced in the elderly but increased in pregnancy, potentially requiring dose adjustments. NSAIDs will double lithium levels. This is the section on neurotransmitters. Neurotransmitters. We're talking the agonist spectrum. Agonist, partial agonist, antagonist, and inverse agonist. Inverse opposes a biological response. Agonist produces a biological response. Antagonist inhibits a biological response. It prevents even the endogenous agonist from binding. Partial agonist, same, but minimal. Neurotransmitter with its keyword or emotion. Acetylcholine, memory. Dopamine, pleasure. Epinephrine, fight or flight. GABA, calm. Glutamate, excitement. Serotonin, mood. Neurotransmitter with its keyword or emotion. Acetylcholine, memory. Dopamine, pleasure. Epinephrine, fight or flight. GABA, calm. Glutamate, excitement. Serotonin, mood. When you think serotonin, think serene-tonin. Serotonin for well-being and mood. Raphe nuclei in the brainstem. When you think serotonin, think head, red, fed. Head, there's going to be an increase in satisfaction and a decrease in anxiety. Increase in sociality, decrease in impulsivity. Increase in migraines, decrease in sex drive. Red to remind you of platelets, bleeding. Fed to remind you of GI motility and nausea. Everything you need to know about serotonin syndrome. When you think serotonin syndrome, think head, red, dead. Head for headache, agitation, and confusion. Red for hyperthermia, hypertonia, sweating, and tachycardia. Dead for mortality, 2 to 13% mortality rate. Dr. Lopez mnemonic for serotonin syndrome. 2 S's, 2 highs, 2 dies, 2 H's, 2 muscles, T, I, C, C. Too much serotonin, high heart rate, high BP, diarrhea, diaphoresis, headache and hallucinations, muscle spasms, muscle rigidity, tremors, irritability, confusion, cyproheptadine plus benzos. Serotonin syndrome by memorable psychopharmacology. Remember, it's caused by too many serotonergic drugs. This mnemonic is shits and shivers. Shits, shivering, hyperreflexia, increased temperature, vital sign instability, encephalopathy, restlessness, and sweating. Dopamine originates in the VTA, including the nucleus accumbens and substantia nigra. Has an inverse relationship with prolactin and an inverse relationship with acetylcholine. The mnemonic for dopamine: D for drive, O for psychosis, P for Parkinsonism, A for attention, M for movement motor, I for inhibition of prolactin, N for narcotics, E for extrapyramidal. Drive, psychosis, Parkinsonism, attention, movement, inhibition, narcotics, extrapyramidal. Norepinephrine effects. When you're surrounded, say, oh, pff. It comes from the locus ceruleus. Norepinephrine effects. When you're surrounded, say, oh, pff. It comes from the locus ceruleus. The F's for the mnemonic stand for fear, focus, fired up, fasting, feedback inhibition, and full body response. ACH acts on the parasympathetic nervous system at muscarinic receptors, giving us the sludgy BM. Sludge EBM, salivation, lacrimation, urination, diaphoresis, gastromotility, emesis, bradycardia, and meiosis. understand the differences between norepinephrine and acetylcholine. Norepinephrine associated pathology is increased anxiety, decreased depression. Acetylcholine associated pathology, increased Parkinsonism, decreased dementia. We're learning what we need to know about the neurotransmitter GABA. GABA is associated with lowering anxiety, lower anxiety. It's a chief inhibitory transmitter. It's involved with relaxation, decreased breathing, muscle relaxation, and no anxiety, no seizures. Now the neurotransmitter glutamate. Remember, glutamating. The most abundant neurotransmitter. It has to do with excitatory actions. It works directly and in volume transmission. It's involved in most brain functions like memory and learning. The associated pathology, an increase in psychosis, mood lability, and seizures, and a decrease in impaired memory and negative symptoms. Just a quick note, an increased level of corticotropin-releasing hormone in the amygdala, hippocampus, and locus ceruleus increases the symptoms of anxiety. Differences. Norepinephrine, blood vessels. Epinephrine, heart. Epinephrine, fight or flight. Norepinephrine, concentration. Dopamine, pleasure. Serotonin, mood. GABA, calming. ACH, learning. Glutamate, memory. Endorphins, euphoria. For learning function, epinephrine, fight or flight. Norepinephrine, concentration. Dopamine, pleasure. Serotonin, mood. GABA, calming. Acetylcholine, learning. Glutamate, memory. Endorphins, euphoria.